Everyone, my name is Ilse Aguilar,
And I'm Leslie Ruiz.
and today we're going to talk about a study that tested a new way to treat skin cancer in people who have had a kidney transplant. And the topic is: does the semi-playmat prevent kidney rejection while having cutaneous squamous cell carcinoma? Before I explain the major key terms, there's something important to know about the topic. The kidney transplant patients have to take drugs every day to stop their body from rejecting the new kidney, but these drugs also make it easier for them to get cancers, especially a type of skin cancer called cutaneous squamous cell carcinoma. The usual cancer treatment that boosts the immune system can cause the body to reject that transplant. So this study asks, can we still treat the cancer with the immunotherapy without harming the kidney? So there is some few key terms to know. The semi-polymer is a cancer medicine that helps your immune system fight the cancer, and the cutaneous squamous cell carcinoma is a type of skin cancer. And mTOR inhibitors are transplant drugs that can also fight some cancers. And pulse prednisone is a steroid given in short bursts to calm the immune system during the treatment. Basic information of the experiment. The experiment was based on a group of 12 people who were 18 or older that had advanced cutaneous squamous cell carcinoma with also kidney transplant less than 6 months ago, using semi-playmat to see if the kidney will be rejected in the body and if will increase the risk of skin cancer. There were restrictions that was included for the patients to be able to participate in the experiment, low levels of protein in their urine, and had to stop taking certain immune suppressing drugs before starting the experiment. How they tested. The starting of the experiment, patients were switched from their current immune suppressing drug to a mTOR inhibitor and started taking 10 milligrams of prednisone, and once the drug levels was stable, they then began getting semi-playmat through IV every 3 weeks for 2 years. They also got extra dose of prednisone to help manage the immune response from the semi-playmat treatment, starting off with 40 milligrams daily before and during the first few days of the experiment, then it was reduced. You can see here there's 4 pictures that are showing the superior side of the skull. We see the before treatment on the right and the after treatment on the left. It shows how well the treatment worked. On the right, you can see the cancer before treatment. It shows up as a dark areas in the scans. And on the left, after using semi-playmat, those areas got smaller or disappeared.
It shows how each patient's kidney function by the measurement of creatine level, the starting and during the treatment throughout the months. Pre and findings. No patients in the experiment had a kidney transplant rejection and neither a serious rise of creatine level, which tends to be a sign of kidney problem. All the 12 patients had a side effect, whether it was from semi-playmat, the mTOR inhibitor, or the prednisone. 11 out of 12 patients had tumors in their head or neck area, and 7 patients had cancer that had spreaded. Everyone had surgery for their skin cancer. The most common side effect was skin problem and fatigue. One patient died from an allergic reaction that caused breathing problems, and it happened shortly after the first dose of semi-playmat. Opinions on the conclusion of experiment or any controversies. We think this was a really smart way to balance the treatment of the cancer without hurting the kidney transplant. We agree with the study's conclusion. It shows how immunotherapy can be safely used in transplant patients with the right setup. But they need to test the patients more to be sure they don't have other types of infections or illnesses that can affect the testing of the treatment. And they need to explore more on if it's better for patients to use small doses of steroids to maybe prevent the cause of other infections. How does this finding help us? By using cemiplimab along with mTOR inhibitor and pulse steroids, monitoring patients closely when adjusting immune suppressing drugs, the study showed it's possible and safe to use this kind of cancer treatment to those patients who have kidney transplant, as well as preventing cutaneous squamous cell carcinoma from coming back.